Yes, good afternoon. I hope all of you have enjoyed the day, and we did enjoy as well answering quite a few questions which were in the Q&A, and we have answered those. We have just seen three excellent examples where implementation research has worked and is working. I'm sure all these three teams did face a large number of challenges while they were actually introducing themselves or the research team into these stakeholders. Who are these stakeholders? What are these stakeholders doing in the implementation research? And what are the challenges around that? That is what we are going to try and understand in next 15 to 20 minutes. I'll try to see if I can finish in 15 minutes so that we have 5 minutes for question and answers. Why engage stakeholders? Most researchers, most funders, most collaborators in India or outside, everybody talks about engage stakeholders. And when they say engage stakeholders, it's about we as researchers engaging somebody, for instance, from the health system. But are we here talking about health systems, people alone as stakeholders? And why do we engage them? One important reason is to achieve the final goal of improving patient care, knowledge and well-being, which is obviously also the ultimate aim of the health system itself. Making an intervention more relevant to the user's need. Now, if we do that, who are the stakeholders who will help us to make our intervention relevant? We need to identify those. It helps in decreases the ambiguity and early acceptance of the meaningful findings. Yes, you have findings from your research, but if you have to make these findings more meaningful, you have to work with the health system, with the appropriate stakeholders, engage them. How do we do that? Better impact and acceptability of any intervention you are planning. That is again important, and it could be achieved best only if we engage the stakeholders in time. Reducing barriers in implementation. Yes, we know that if you do not engage stakeholders, there are going to be more and more barriers, and these barriers increase their height if you do not engage them in time and appropriately. Lastly, the facilitating the process of implementation. It becomes much easier if you have the stakeholders engage with you. But if you want to do it, how do you do this? For all the people, especially the learners who want to engage into implementation and research in the near future, please keep this in your mind. This table itself tells you everything. Look at this. If you have a high power stakeholder which has power to block or create change, it may be both ways. And that person or individual has low impact and low stake in the research. Then what you need to do, you need to only satisfy that stakeholder. But if you have a stakeholder who has very high impact and a high stake in the research, at the same time also is very powerful enough to either create change or to even hinder the change. But believe me, these are the stakeholders who you really cannot satisfy them, you cannot monitor them, you cannot inform them. The only way you could handle them is manage them well. So if you identify stakeholders, put your stakeholders in these 4 boxes. Either you satisfy them, manage them, and those who cannot be managed, those who don't need to be just satisfied, but we know they have low impact in the sake, but at the same time they also have low power to block or create the change. Such groups may be ignored if at all it is possible to, but it is not necessarily to be ignored. As far as possible, every individual stakeholder must be involved in it. This is just that this is the stakeholder which may be ignored, not always, if at all needed, only then. Especially when there are resource problems, then only you go there. There are people like patients as stakeholders, often fall into this category because you need to inform them very well what your intervention is likely to do with them, how it is going to benefit them. Just keep them informed very well. It may be helpful to take steps to increase their influence by arranging them into groups or taking active consultative work. But if you keep them informed, that is more than enough, because we know the maximum impact to your intervention could be achieved. That's why we'll have a very high impact. So these are the 4 categories. Now let's see an example. This will tell you, these are just the examples. Your implementation research will decide who are your stakeholders. I'm just giving a few examples which we feel appropriate in the state of Maharashtra. It may be appropriate for other states elsewhere, or you may be terming these differently, but there may be other stakeholders which you could put into these 4 categories. Now, for example, the Gram Panchayat representative. We know that will have low impact because they are not going to be actually implementing. They are not going to be deciding the implementation. They are not going to be changing the implementation, whatever you have decided. But they have definitely very high power, either to support your intervention or to block your intervention. So what you do is you keep them satisfied. Tell them that, okay, whatever you're doing is good for the population. Be with them. Now talking about the study participants, community, public health systems, funders, the healthcare providers, and so all these people, we know that they have very high power. They refuse, your intervention goes wrong. At the same time, they also have a lot of impact, because if they are not taken into confidence, if they don't do it properly, your intervention itself will not happen appropriately. So the best thing is you continuously manage them very well, because you can't change them. You can't really satisfy them. And that's a good quality of maybe a health system person, that should never be satisfied with what they are doing. They should always be inquisitive to improve every time. So whatever intervention is given to them, they will try to ensure that, can this be improved better so as to suit our needs, so as to suit the needs of our population where we intervene with all the programs. And that is why this category is extremely important. The researcher, if you talk, you yourself, the researcher, when you place yourself in that position of a researcher, you know that you will have very low impact and low stake in the research per se. If you try to keep your stake high in any implementation research, trust me, it's going to be a failure of your implementation research. If you want to strengthen your implementation research, you have to learn that you keep your impact low. You should have low power, because the power should be with those who are actual implementers. And you should never be the people who would block or create the change. Who are the people who are going to create the change in implementation? It's going to be the people themselves, those who are implementers. So keep them. And lastly, the newspaper, the media, these people, you should keep them informed all the time, because if you don't inform them, then they are going to have very high impact. That's why, although they have low power, they are very important. I think this tells you. Now let's try and understand who are the stakeholders. You all know who are these stakeholders. So these are all the stakeholders we have to keep in mind. We're going to see each one of them separately. Patient, population, community. Now in this, what happens, it's going to be one-way interaction mode. We are going to engage, because it is engaging them by informing. To inform them, you have to engage them. These are just a few examples, what you see on the screen, like at the street play. It's about the H1N1. During the H1N1 pandemic, we were informing the people in our rural areas where we work, during the market areas and in the bus stands, about the H1N1, the hazards, how to take care of themselves and all those things. But it really worked very well. But it was one way. We were just informing. We were not asking questions from them. There are films. It's again one way. There's no pamphlets, distribution, dissemination meetings. We go and disseminate about the findings of your research. It's again one way. We might allow them to ask a few questions, but still it is one way. Now see what happens when you involve them. When you involve them, That is beyond engagement. And that's where the PPI, keep this word in mind. Nowadays, you will see in the recent past 5 or 6 months or maybe a year, and now in future, you will see everywhere globally this word or the term PPI, patient public involvement, is coming up like anything. There you have two-way, and you can involve them right in conceptualization, planning, and conduct of the studies, analysis, planning and dissemination. Everywhere you can involve them. It's not just informing them. So this is how, your stakeholder engagement goes into stakeholder involvement, and that strengthens your stakeholder engagement in turn. That's why you have to keep it in mind. Involvement is a crucial task that you have to do if at all you have to implement an intervention, a new intervention in the program. This is just an example. As part of research team or research committee, you have to contextualizing research question. If you want to do that, how do you do that? You have a question in mind, but how do you do that correctly? How do you contextualize it? Go to the stakeholders, talk to the people, involve them in contextualizing. That will help you. Same is with tools preparation. Which tools work better for this intervention to be implemented in a better manner? How do you do analysis? And when you do it, how do you really make it very community specific dissemination? Because unless you do it for the community where you're working, it may not work to the satisfaction of the community, which is important stakeholder, as well as the implementers of the program, who are another very important stakeholders. If you have to be with them, you have to involve them right from the beginning. Look at the healthcare providers and implementers and stakeholders. I think this, we don't need to go into the details, because every researcher, irrespective of whether it is implementation research or otherwise, has been doing that. I believe most of them do that. Most of us do that. And we do that in order to ensure that our research activities go through smoothly in the community. But when it is in implementation research, it is more important, because we are not going to do any activity. It is going to be the health system implementers who are going to actually intervene with the ideas or with the intervention programs. If that is to be done, we need to keep this in mind. So it may be the ASHA, ANM, the public health system, the private health practitioners. These are also equally important. As Sudipto mentioned in one of his presentations just before, private practitioners were the people who were approached by the population there, and not necessarily the public health system. Then what? And you forget them in your intervention? That's not going to work. So ensure that you will also involve them, engage them right from the beginning. Rural, subdivisional, hospitals, everything. These are all the examples which are very important. Inform, educate, consult, involve, collaborate, empower the population with as much of knowledge as possible, so that you get better engagement of the population. Decision makers, obviously we have to engage in any implementation research, because even now in most of the LMICs, we know that it is top-down approach which works a little better. I don't say that the bottom-up approach do not work, but we know that it does work if we go to the top levels. What are the ways we could engage people? There are plenty of ways, and these are just some of the ways you could see in the pictures. You build their capacities by training, giving them opportunities to work for their own communities. You can see left-hand side bottom, there is an individual who is a localite. We train this person because we wanted to engage the community more, and more so we wanted to involve the community in activities which we propose in a research activity. And then we involve this person by giving opportunity of training to conduct heart rate variability testing. And it worked really very well, because the moment we did this, we had more and more people. So more and more population started coming to us for more opportunities to learn. And that is what you see under the right hand side, both pictures. More, for example, those days we were using the GPS coordinates were taken by cell phones, were not having that facility. So those things were small tools were used, and engaging the people, involving them to do these things for their own coordinates, taking you use them. I think they are more than happy to involve themselves. So this is how it helps. There are other modes of engagement. And as I said, either top-down approach or bottom-up approach. Both approach work well, but both approach, we have to be intelligent enough to understanding what is the type of intervention that we are going to use in the implementation research. Based on that, you decide which approach works well, and then go ahead with that. And lastly, the media. You can never forget this stakeholder, because if you forget the stakeholder media, as I said, they have less role to play. They're less powerful, but they have a lot of stake, because they can change minds of the population. They can change minds of the people against you or in favor of you, howsoever difficult or easy the implementation may be. And that's why please keep them informed. Don't engage them, don't involve them, don't keep on trying to manage them, don't monitor them. You only do is inform appropriately, and that will help you to implement your research very well. That's the last slide. And this slide tells us how interwoven is the implementation research. If you follow these principles of effective stakeholder engagement in your implementation research, be it collaboration, you have to collaborate with every stakeholder. And to some stakeholders, you have to involve them. You have to be very transparent with them. You have to have good trust, win the trust of the stakeholders. Ensure that equitable distribution happens when you intervene with any activity, and have respect for every stakeholder involvement. And that is how going to be very good implementation research if you involve stakeholders in all your planning. For any implementation research, we need to keep in mind that you think very well, think a lot, think 10 times before you take action. And once you have thought enough, plan appropriately and prepare the best way you could, and you are going to succeed in your implementation research. Thank you very much. I'm going to stop here and over to Sudipto if there are no questions, I believe. Or if there are questions, we would definitely answer these questions in the QA box later.